Coronavirus infections are again on the rise around the world. Portugal was among the first European countries hit by a new summer wave. And while case numbers there are now starting to fall, they are increasing in countries including the UK and Germany. So what can they learn from Portugal's recent wave? Nicole Rees reports from Lisbon.
When Carlos Leitao's voice fills the air of the Clube de Fado in Lisbon, everybody listens. The melancholy sounds of the traditional Portuguese music are once again attracting big crowds. The pandemic seems far away. There's no social distancing, no masks, just music.
We try to come back to our way of living, and of course, sometimes we're afraid when we see the news and something like that.
News such as that about the new Omicron subvariant BA5. It's spreading so quickly that infection numbers in Portugal recently reached an all-time high, but with less severe illness. Still, the spike in infections brought higher COVID death rates among the elderly. Now that case numbers are declining, epidemiologists like Manuel Carmo Gomes are able to evaluate the severity of the last wave.
If you take the number of cases that there was into account, then you have lethality, which is the percentage of cases that die. And lethality has remained very low after Omicron. Actually, it's a level that is comparable to seasonal flu or even less.
Carmo Gomes says that the new Omicron subvariants very likely evade the antibodies that people have developed. At least 15% of COVID cases in Portugal are reinfections due to the many waves fueled by new variants.
This virus does not seem to have a seasonality similar to other respiratory viruses. Its transmissibility is so high that even if people start living outdoors, like in the summer, there will still be transmission.
He's hoping for a new generation of vaccines that not only prevent severe disease, but also suppress transmission. In the meantime, it's vital that people remain alert, which is what these tourists are doing as they enjoy wine tastings and traveling again.
We've waited for 2 years to come here. I think this trip was canceled in one way or another at least 4 times. And when we had the opportunity to come this summer, we decided it's okay, we've been vaccinated, we've been boosted.
And so we were going to come regardless, and COVID is very bad in Washington, D.C., so we've sort of learned how to maneuver through the bad parts of it.
As have many others here in Lisbon too.
So is it safe to travel here again in Europe? Joining us now is Christian Lindmeier, WHO spokesperson in Geneva. What is the takeaway for Portugal, where over 90% of the population is vaccinated?
Well, it's a very good example for Europe and for many countries, and that's of course exactly what we would like to see everywhere, because as we've seen on the report and as we see it with this new variant or with the new sublineage, while we don't yet exactly know the details about the severity of it, we see that while we have many new infections, the death rate is low, which is very good. Yet we shouldn't be complacent because we do have a death rate and we do have deaths. But if we reach the high level of vaccination rate all over the world or all over Europe, we would be a big step forward. That's the target to reach. We wanted to reach 70% of the world's population by half year this year. We're not quite there yet. In a global number, we are at 63%, but we still have a third of the world's countries who haven't received any dose yet. So there's a huge imbalance, and that imbalance we need to settle, and we need to make that straight. And once we have a good coverage everywhere, from the weakest to the most vulnerable to everybody, then we can be much safer looking into the next weeks and months ahead.
Well, historically, the Portuguese have always been on the side of getting vaccinated. Should other European countries be on alert about this?
We need a package. It's never only one thing. It's never only the vaccines. And the vaccines are highly important, and we strongly believe that the low death rates we see right now are attributable to the fact that a vast majority of the European population is vaccinated, or actually many in the main traveling countries around the world. Yet it is important to keep your masks with you, and if you're on a plane and it's high density, if you're in a group, wear your mask. Because I think right now, at least in my personal environment and in the colleagues and friends I have, everybody knows someone who has just been recently infected or is sick right now. So it is spreading and it is going around. Luckily, we haven't seen many severe cases yet, but we have to be in the lookout and be ready. We have to keep testing. That's important, because if we give up testing, then we don't know the picture. It may look lower then, but we don't see the full picture. So everything, testing, masks, be prepared, be vaccinated, the whole package together, and then we're much safer.
Okay, so get your booster, keep your mask at hand, and keep on testing. You heard it from Christian Lindmeier from the World Health Organization. Thank you.